Welcome to CareTalk, America's forum for incisive debate on healthcare, policy, business, and politics. Today, our guest, Eugene Borukhovich, one of my old friends, who's going to tell us a little bit about the impact of coaching and the new insights he's found through the business he and his wife, Marina, have founded in how to really drive the behavior change that all of us need to see in the healthcare system if we're going to move beyond a healthcare system that spends too much and does too little. Eugene, welcome, and welcome to CareTalk.
John, great to see you, and happy to be here on CareTalk. I've been following the podcast show for quite a while.
Well, and the great thing is, since you shamelessly post everything you do, we will get some extra promotion, regardless of how we do in this conversation.
Absolutely.
So I'd love you to, coaching is one of those areas where people sort of poo-poo it in the same or don't take seriously necessarily all of the human changes, the behavior changes, and hence the role of coaching, counseling that could be critical to change. That's why I'm so excited about you and your business and what your early results show with patients. But maybe let's go back a little bit, because I knew you as the healthcare IT guy who got us out of trouble or could build stuff from scratch. But maybe tell our audience a little bit about how did you get here? Where did you grow up? What got you into healthcare, and then the arc of how you got there?
No, listen, absolutely. And by the way, when we did work together, I still had a lot of hair. And I think to a certain extent, healthcare, well, okay, not a lot, but I had some hair. So very short geographical kind of frame here. Born in Ukraine, my parents immigrated. So I'm a son of immigrants, grew up in New York, New Jersey area, and, spent half of my career at the time with a PBM. And then we actually moved to Amsterdam now 14 years ago, and now been kind of hopping around Europe. And YourCoach is
but you were building digital businesses, helping digital businesses start when we worked together in New Jersey, and then when you went to Europe to help us launch our European businesses. And so you've got a deep background in healthcare and healthcare technology. And what I remember about you, Eugene, is that you were quite talented and creative with sort of a build from scratch that did not intimidate you. Other folks were looking for sort of large tech or conventional solutions. You'd be looking for the innovative entrepreneurial ones. And so how did you get, that strikes me as a really good way to build a living. How did you end up in coaching?
So let's fast forward through all of that. And indeed, I love building from 0 to 1 to 10, 10 to 100. I self-admittedly, I'm not the incremental innovation guy, right? But let's back up. This was almost a decade ago. And I was actually still working, with a large pharma company where I was doing quite a lot of digital therapeutics. And so again, a big believer in interventions that are driven, software-driven interventions.
And just explain to the audience kind of but maybe slow down 1 second. Sorry to interrupt. What is a digital therapeutic?
Yeah, so a digital therapeutic, think of this as a digital medicine. So instead of swallowing a pill, you're actually using your iPhone or any other, digital device to take a load of medicine. And again, there is a Digital Therapeutics Alliance that's actually great news for everybody. It's been merged into the ATA, American Telemedicine Association. So together, they are in Washington, D.C., and kind of making sure that both telemedicine as well as digital therapies, and by the way, digital therapies can be along with a molecule and a drug or standalone intervention as well. So hopefully that explains digital therapies. But for those that don't, I've actually had 3 seasons of a digital therapeutics podcast, a shameless plug, with some founders there. So digital therapy. So I was, helping get those off the ground with working with a number of startups. If I rewind even a little bit further back, so my wife Marina, she is my boss in real life and now in business. She was diagnosed with breast cancer 10 years ago. Went through that crazy time. Obviously as an individual, but we as a family. And upon her recovery, and this is her words, she thanks the healthcare system and the medical community for saving her life. But when everybody said you're good to go, in her own words, she said, I was the most broken I've ever been. And that's how she discovered health coaching. She became a health coach herself. She started practicing with her clients. And given what we just talked about, my health tech background, I kind of said to Marina, I'm like, well, you can't manage your business, one with WhatsApp, one with, Facebook Messenger, et cetera. You need a platform to manage your business. And so that's how YourCoach was originally born. But at the same exact time as we were spinning it up, we saw that American Medical Association, together with the National Board of Health and Wellbeing Coaching, issued level 3 for our listeners here. Those are test codes that the AMA issued. That means that it needs more data to move them to level 1, at which point health coaching could become reimbursable.
And so, codes, Jay, I mean, just to be clear, that what you're talking about is the arc of progress in terms of taking a novel idea that may or may not help patients, figuring out a way to test it before it becomes something that a licensed provider could then charge Medicare, Medicaid, and commercial payers to reimburse. But maybe you could go a little deeper, because I know Marina felt this very personally. She felt broken, but normally isn't now the time at the end of an illness, and obviously I'm asking a rhetorical question. Lauren, as you know, went through this as well. Yeah. What did the healthcare system not provide that it should have provided?
Yeah, and to be frank, we actually were living in Amsterdam and got unbelievable health services surrounding it. As the Dutch said, we don't advertise it as well as Americans, but we're really great at it. And it was more around her recovery. And it
costs a hell of a lot less.
And it costs a lot less. And I think for many of the listeners that know that, if we rewind back, Obamacare was supposed to be really modeled against the Dutch system. I know the Obama administration at the time actually spent quite a lot of time in Netherlands, and then it got kind of pseudo butchered along the way, but that's we're not jumping into the politics just yet. And I think on her recovery mode, they wanted her to see therapists, and her comment around it was that I actually don't want to navigate therapy and go back in time. I actually want to face the future and work on my physical and mental health. And a lot of that was outside of therapy, that typically starts going backwards and then starts looking forward. There was nothing else available, right? And so she kind of became a health coach herself.
But you're on a really important point, Eugene, because cognitive behavioral therapy, which is the convention, non-drug, not pharmacy supported therapy, is typically one where you do go back and you explore elements of your psychology. I'm not going to get into it because neither of you are qualified there. Whereas coaching is typically, and people should think about a sports analogy here, it's where it is focused obsessively on today and tomorrow, and what tools support systems that you need to actually take advantage of to optimize today and prepare for tomorrow. And that is a very different approach than the conventional healthcare system, which is either fixed or I guess rear view mirror oriented.
And I would also, one key thing is, healthcare system is prescriptive, and it is prescriptive for a reason. Health coaching is a non-clinical profession. And by the way, just to round back, it's been around for 20 odd years. It's only in the last 6 or 7, because of the lack of clinical staff just in our system, because of lack of preventative measures, only in the last 6 or 7 years, we've actually been seeing studies upon studies of health coaching interventions across the continuum of care, right? And this is if you look at health coaching and how it uses, actually, interestingly enough, similar techniques as therapy, right? It's cognitive behavioral coaching. It's using motivational interviewing. It's using, aspects of trans-theoretical model of change. But this is, in a way, again, to your point, it is looking very much forward, and I would say preventative in a way. How can I help myself stay consistent? We all know what we need to do on a daily basis, right? It's how do we stick to that routine, and what's the psyche behind it and why, right? So that's a big component. And again, the industry has been here, but we've seen kind of resurrection of it, if you will, which is, I think part of the AMA CPT codes in 2019 was still a little bit, far away in our belief system, probably another couple of years as the studies come out. But the positive thing is also, and I'll pause after this, is CMS, and let's see where it goes with the new administration, but CMS also included a health coaching pilot against those same 3 codes in the physician fee schedule last year and in 2025 as well.
And
Medicare.
Just to be and just to be clear, the Center for Medicare and Medicaid Studies, the Center for Medicare and Medicaid, studies these issues and generally looks to prevent new codes, to restrict because of the all of the cost pressures. But you touched on something a couple of paragraphs back, Eugene, that I think is really important. Over the next 10 or 15 years, we're going to be about 1 million clinicians short relative to the doctors and the nurses we need. And that's because of the appropriately deep education and practice that's required, the limited number of schools and universities and colleges that provide those nurses and doctors, and the current and expected restrictions on immigration, and yet the aging of the American population. And so one of the interesting things about coaching registered dietitians, these bottom of the pyramid licensure, where it's a lot easier to engage, get trained, and support, actually may provide some ability for us to manage some of the needs, because I think we're still just scratching the surface of what some of the just as talented but less licensed labor could potentially do to help us potentially change the arc of chronic disease and suffering in America. And maybe you could talk a little bit about that and why we should be both potentially optimistic about recruiting more people to help us get healthier, and what we need to worry about, what might be the risks there about increasing the role of coaching in healthcare.
Yeah, and I know I said this before, and we're very, very clear. Health coaching is not there to replace doctors and nurses, right? Everybody has a role. And unfortunately, in our healthcare system, I, as a patient, have only 8 minutes to visit my doctor, right? And I get some kind of a care plan, and then I go back into my normal life that has all the stressors and all the things that just, unfortunately, I start falling off my care plan. Now, so I think this is a workforce that is well trained, but you were one of few people that actually know what health coaching is. If I go out on the street and ask 10 different people, I will get 10 different answers, because health coaching is still an unregulated profession. Yes, there's a National Board of Health and Wellbeing Coaching that is setting standards, that it has now something like 150 plus schools accredited for health coaching. And this is undergrad, graduate, and continuing education schools. But we very strongly believe, and this is a bit of our uniqueness in the model, is that we also need real world data on how these coaches are really doing in, quote unquote, in the wild, right? And that's part of our platform. And we have now 4,000 plus coaches practicing with their own clients. And we're adding that extra level of validation and verification.
And just maybe double click on that, Eugene.
Yeah.
what's a client? Like who would hire you to do what?
Yeah. So to be clear, coaches bring their own individual clients. They use our platform, right? And they charge whatever they want to charge. And we leverage a lot of the data to understand, and we track coaches across 16 or 17 categories, everything from heart health to mental health, women's health, name it. And leveraging that data, we contract with the best of the best coaches. Where our revenue stream comes from, our clients, we're about 75% of our business is a white label solution. These are companies that range from digital therapeutics companies. So again, self-paced content, whether it's validated by FDA or not. We have direct-to-consumer companies. So think of like intermittent fasting as an example. We have medication adherence companies. Again, these are mostly software type of companies that realize that they need a human in a loop to help these individuals with their behavior change along the way. That's about 75% of our business.
So what you're creating, just to put it in my words, is a tech-enabled platform that connects, that qualifies, connects, and supports the pretty massive growth in individual coaching across a number of different domains, to connect those coaches to largely digital health companies that need, to your point, a human in the loop to perform that human connection and coaching that they otherwise wouldn't be able to do because their expertise is software, clinical data, or a particular angle on how to innovate through digital means, but ultimately that depend on some element of either human connection, communication, or change. And that's how they integrate coaches. Is that the right way to think about your coach platform?
Love it. Absolutely. And I think we're going to cut that and use that as our ad from now on, John. So thank you for that. But I wanted to also kind of add, so this was sort of our phase one, go to market as we scale. We're now navigating health plans as almost like a headless health coaching service as well. And we are servicing employers direct through brokers as a mental health support.
And okay, so now we understand that coaching can help. It's a different approach than therapy, that you provide the platform. You've got some experience. What's been the experience of your customers, and does this stuff work?
So perfect timing. Just literally in the last couple of weeks, we went back and randomly selected 150 individuals from all the opt-in transcripts. So N equals 150. And yes, it's retrospective, and yes, it's observational. But we ran, this data through, and basically the results are honestly exceeded our own expectations, even though we know it's working. This is we selected individuals with 2 or more sessions. And typically individuals have a session, and this is a live session, voice or video, within, 2 within a month or 1 a month, right? And we didn't differentiate there. So 2 sessions. And within the 2 sessions, we saw average across the 150 individuals, almost an 18% reduction in GAT-7. So this is the anxiety and stress score. We also measured resiliency, which is another measure called RAQ-8, RAQ-8, and that increased almost 11%. The one interesting part, and we've been talking about behavior change through this now, 63% of those individuals moved along that trans-theoretical model of change. So from, say, contemplation to action, as an example. And there's a breakdown of that. So we saw, honestly, tremendous results. And this is, I think for some of the listeners, with a clinical intervention, which could include a drug, therapy, the kind of the typical, what we see on average, the anxiety and depression scores can go down between, 20 to 50%, and that's with a clinical intervention. So with this non-clinical intervention, and again, retrospectively, we saw an 18% reduction in just 2 sessions. So this is working. And then, lastly, because we're sort of this white label solution, we're also seeing much higher engagement with either the core content or 73% of all the users, because our coaches see other benefits that are available, other content, 73% of the individuals were contextually recommended. So this is not coaching pushing it, it's as their needs arise. So, I can use the example of, I just need to have my pet surgery and I'm working for an employer. Well, if there's pet insurance available through the employer. And again, it's very contextual. This is not something that coaches are as their core, right? Which is an important piece of this.
And so, Eugene, do companies need to find you, or do individuals need to find you? Like, how do you go to market?
Yeah, so we don't do direct to consumer. We are working through our white label partners, and this is, quite a lot of inbound, and it is a relatively small community and grows, and word of mouth is working because, our model is working. And we are also working with brokers and employers direct as well.
Awesome. And so maybe as a final question, Eugene, where do you think this can and should go? What would you like to see? Where would you like to see the market, and how would you like to see the market respond here?
Yeah. So, look, the way I look at health tech startups, you can have a product market fit, which we do. But we also need, any startup in health tech also needs like a system product fit, right? If you will. And, I think from perspective of prevention and behavior change, which we've been talking about, that's a check. The urge here to the community and to the decision makers within that system is obviously around the reimbursement, and, that focus on that human being can be there between your AI chatbots and the clinical staff that's just, we talked about the shortage. And this is a human workforce that is here, that's trained, that is empathetic. And, if you talk to many coaches that get into this, they're truly there to help, just like most of the doctor and nursing community. So it's a perfect system fit, minus still the reimbursements. And so we're looking forward to CMS progressing the pilot and seeing where that lands. And we are hearing that even some commercial plans are now starting to reimburse against those T codes because they're seeing benefits of this.
So you basically want the system to embrace what you believe is already working and could change the system.
And we strongly believe that anybody and everybody can use a coach.
I having just come back from the UConn, the parade for the UConn women's basketball team with Gene, built around a 12 repeat national champion, Gene Auriemma. I couldn't agree more. So That's it for CareTalk. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And thank you, Eugene, for joining us.